right. Thank you, Adam. Thank you for that nice introduction. Hi, everyone. For those who don't know me, my name is Tim, and I am one of the physiotherapists here at SEMI. I can't believe myself, but I've been here at SEMI for over 10 years now, and this is our first time we're doing a webinar, but I'm glad that we're able to just come today and share some of the knowledge that I've gathered over these years in practice, and hopefully share some of this information with you guys. I know we're all stuck and regretting and dreading this second lockdown, but like you guys, I'm hoping that we come out of this relatively quickly and hopefully injury-free, which comes to my topic for today. If you guys have been with us these past couple months, we've been trying to introduce some of the things that have been happening here at SEMI. And if you're with us with our first webinar, we were lucky enough to have Dr. Penny Reed give us a talk on genetics, giving us an update on the role that genetics has to play and potentially its effect on things like diet and exercise. If you were with us last month, Dr. Stoddard and our team of physicians of Dr. Reed and Dr. Gordon gave us a quick update on what's going on in terms of PRP injections and its role that they have to play. And for those that have been dealing with stubborn and chronic injuries, I'm sure you might have found that webinar to be very relevant and hopefully very enlightening. So if you didn't get a chance to catch those are posted on our website. But today, I'm going to be bringing you and changing a topic up a little bit, and I'm going to be sharing with you more from the physiotherapy side of things. And I thought this topic would be relevant because since coming back into practice after the first lockdown, there have been certain injuries and certain themes I have been seeing in my clinical practice that I want to share with you guys. So I named this webinar, Coming Out of COVID Injury-Free, a discussion on posture, ergonomics, work from home, and injury prevention. So let's get into it. So posture, ergonomics, these are the same things we're going to briefly go over and hopefully get into the idea, the area of injury prevention and giving you some of my tips and ideas of what you guys maybe should be careful with so that you guys can stay injury free. What I'm hoping you guys will learn by the end of this, I'm going to do a quick review on the basics on posture, ergonomics, and working from home. I know this topic is not necessarily new, so I'm going to go over it relatively quickly. And if there's anything that may need a little bit of clarification, feel free to post it in the chat and I'll try to answer and clear some things up at the end. What I really want to get into is debunking some of the common myths and beliefs that are quite prevalent in this area. I'm going to use and keep you guys updated on some of the latest research regarding these topics. And hopefully at the end of all this, you guys can apply this new knowledge to improve your overall health. So when we're talking about posture, it is first good to learn the different variances and the terminology that we associate posture with. So if you're looking at this diagram here, the one on the far left, the green one, is what we call the neutral balance posture. And in a neutral balance posture, we want to see relatively normal curvature in the spine and good weight distribution and not too much of a forward head posture. Now, as we move towards the right, we have what we call lordosis. We have a kyphosis, flat back, sway back, and a scoliosis. I'm going to be explaining a little bit more of some of the more common ones that we tend to see at our clinic. First one, the sway back. If you guys can see in the picture, that gives a good little description of what we would tend to see when someone comes in with this type of posture. So as I said, this is very commonly seen. Some of the telltale signs is that someone will have their hips slightly pushed forward when they're in a standing position. We'll tend to see some exaggerated curves in the spine, whether it's a slight increase in their kyphosis in their upper T-spine, or a little bit of an increased lordosis in the lumbar spine. That's when we're referring to the types of curves that we kind of see. I will want to bring up the point that when we're talking about posture, it is actually normal to have a little bit of lordosis and a little bit of a kyphosis in parts of the spine. What this posture is talking about is there's a slight exaggeration in either of these curves in these areas. The common appearance that people will tend to see is an appearance that someone is leaning back when they are standing. So when someone is coming to us with this sway back posture, there are some things we naturally will look at. Because they're leaning back so much, they might naturally have a tendency of having lengthened abdominal muscles. That may mean their core musculature might be a little bit weaker because of the little bit of the anterior pelvic tilt that is occurring in this position. They might have slightly tighter hamstrings as well. If they are compensating in the upper body, they might have that forward head posture and rounded shoulders. So they might have a little bit of tightness in their pecs, as well as a little bit of strain in the cervical extensors. Moving on to the second one, lumbar hyperlordosis, another very common type of posture that we see. And this goes in when we're talking about the lower lumbar, the lower back region. And this is when there's an enhanced lordosis in that lumbar spine. What causes this is similar to that sway back, is when your hips are rotated anteriorly. And in physiotherapy, we call this an anterior pelvic tilt. Telltale sign, without getting into the details, is that it looks like the appearance that your butt is almost sticking out a little bit. So if you're in this posture, if you're in this position, naturally sometimes what may happen is you may also get lengthened abdominal muscles, which potentially can put you at slightly having weaker core muscles. You may have lengthened hamstrings as well, causing a little bit of tightness in that area. People also may have tightness into some of the groin muscles, tightness into the lower erector muscles because of that pelvic tilt. So lots of times people might come in telling us that they have these types of symptoms if they're presenting with this. Last but not least is the classic kyphotic posture. And you might have heard of this one as the hunchback posture that we tend to hear and see. And this is the classic rounded shoulders and upper back. People will naturally come in with a little bit more of a forward head posture if they're coming with a little bit more of a kyphosis. In very exaggerated cases, sometimes people also have an appearance of a bump on their upper thoracic spine. Just like some of the previous ones, if you have a kyphotic posture, you come in with a kyphotic posture, lots of times because you're in that forward head position, the cervical neck extensors, which are the muscles in the back, tend to be lengthened a little bit, so there may be a feeling of strain. The muscles in the front of your neck, your cervical flexors, as well as your pecs, those naturally will get a little bit tight, and people will feel that sensation of potential tightness into the front of the neck. A lot of times people with the kyphotic posture will complain of things like suboccipital headaches, which are headaches originating from the base of the neck, or tightness into the upper back and in the shoulder blade area. All right, so then what is the ideal standing posture then, after we talked about the three variances? Well, probably a lot of these things you guys have already heard about, whether it's from our parents growing up or from our gym teachers way back. The ideal standing posture consists of a lot of these common elements that we hear all the time. It should be chest up, shoulder blades back and retracted. There should be a slight lordotic arch in the cervical and lumbar spine. As we're saying, it is normal to have a little bit of that. We just don't want too much exaggeration in either area. There should be a little bit of kyphosis in the thoracic spine with your head held in a neutral position. If you're standing, there should also be relatively equal weight distribution on both feet. So there shouldn't be too much force on one side or the other. Now, what about sitting? I thought we'd have a little chuckle with this picture of Bernie Sanders. I'm sure if you guys were following in on the inauguration, he's become an international meme now. And I think he just makes a perfect example today for us of maybe some of the things maybe we shouldn't be doing when we're sitting. So hopefully you guys enjoyed that a little bit. But going to the idea of the ideal sitting position, what does that mean? Well, there are similar mechanics and same things of what we're talking about in standing. When you're sitting, you also want your chest to be up. You want your shoulder blades to be back and retracted, and you don't want too much of an exaggeration in the curves of the spine. You want your head in a relatively neutral position, and arms and shoulders relaxed with your wrist in neutral. Back should be relatively upright with the lower lumbar support if that is available with your chair. Legs should be parallel to the floor with feet flat to the ground. If we're talking about a workstation, then your monitor should be at eye level. You shouldn't really have to look too high, maybe looking down just a tad bit, but it should be relatively neutral to where your natural resting eye position sits. If we're talking about using a mouse and a keyboard, you really don't want your arms and shoulders to be stretched out too much, and you want your wrist in a relatively neutral position. All right, which comes to the question, why do we care so much about posture? We hear this all the time. Mind your posture, mind your posture. Be careful of how you're sitting, be careful of how you're standing. And if we're talking about this from a biomechanical standpoint, ideal posture essentially is what we believe to be the most neutrally balanced type of position for your body, where the forces acting on your joints, on your muscles, on the tendons are most equally distributed to the best of its ability. There is a belief that if segments of our body are out of this optimal position for a long period of time, then these muscles or the tendons will remain shortened and lengthened in that position. And if that happens over a long period of time, that may result in things like pain, things like discomfort, things like tightness. So there's the natural understanding and thinking that if we have poor posture and poor ergonomics, and this is sustained for a long period of time, then things like lumbar, cervical, thoracic pain will start to persist. As I mentioned, cervicogenic headaches. This is headaches originating from muscles in the back of the neck and the base of the skull. People often report symptoms of shooting pain going to the back of the head, dizziness, or throbbing sensations in the back of their eye. Shoulder pain is often a very commonly reported symptom, tightness across the rotator cuff, the upper trap area, the upper back. Even things like TMJ dysfunction, which stands for temporal mandibular joint. Then this is your jaw, essentially. So we have a muscle called the sternocleidomastoid, which attaches from the jaw into the front of the sternum. And if you are in that forward head posture or that rounded shoulder position, sometimes that can result in increased clicking in the jaw, increased pain in the jaw, maybe a little bit of your alignment in the jaw might be off a little bit. And then what we also know so much is the increased stress on the muscles, tendons, and joints, leading to things like tension and weakness in these areas. All right, now here comes the first curveball that I'm going to throw to you guys. So what if I just told you that everything I just said about posture actually does not matter as much as you think? And I want you guys to just give me a second here. I'm not saying that I want you guys to have that forward kyphotic posture, that rounded shoulders, that forward head posture. That's not what I'm saying. But what a common trend in the physiotherapy world is that we're really trying to get people to start moving away from the idea of thinking so much of trying to attain the perfect posture and start to think about something else. I'm going to bring back the previous slide that I was talking about. Instead of the idea of the results of poor posture and ergonomics, I want us to start thinking about in the terms of movement and mobility. And the result of lack of movement and mobility potentially may be more of the reason of why we have muscle tension, why we have weakness, why we have lumbar, cervical, and thoracic back pain, why we have things like cervicogenic headaches, TMJ dysfunction, stress on muscles, stress on tendons, and shoulder pain. There is a growing trend in the therapy world in that we're really thinking that the idea of trying to achieve perfect posture is one, very, very hard, and two, almost impossible. And if we're continuing to keep our mindset in that area, then potentially we're kind of thinking of trying to tackle this problem in the wrong way. So comes the idea of sitting versus standing at work. We get asked this a lot. Which one do you guys think is better? So here comes our first article that I want to bring up to you guys. And it comes from the Journal of Applied Ergonomics. And this came out in 2015. Taking a look at thoracic and lumbar posture behavior in sitting tasks and standing, progressing biomechanics from observations to measurements. And the idea of the study was they wanted to look at people's spinal posture in 3 different conditions. 1, after just 10 minutes of sitting. 2, give them a cue on what they think is the best sitting posture. And then 3, in the standing posture. And then they wanted to measure their spinal angles in all 3 of these positions. And this is what they found, that after about just 10 minutes of sitting, people naturally just started to deviate and increase their flexion angles in their lumbar spine. Even when they were cued a little bit, they were able to correct that a lot more. But as time progressed, people naturally started to deviate. Now, in the standing position, there was a lot less exaggeration in that curves, naturally, because they are standing. But that just brings to the point of the idea of the sitting. No matter if we have the perfect chair, no matter if we're sitting in the best position, naturally, we will want to start to deviate away from that perfect posture. So the idea of the sit to stand desk, we're asked this a lot. Do we recommend this? Would you recommend getting one of these at home? And if you've been fortunate enough during this COVID lockdown, these have been very high in demand. If you've been able to get one, short answer is yes, we absolutely recommend the sit to stand desk, but not necessarily because it will offer you the best posture. The idea of why we really like to sit the stand desk, it is because it allows for a lot more movement and change of body position throughout the day. Naturally, as you stand, you engage a much more muscle activation, leading to increased caloric expenditure. And who doesn't like that? You also have the option to just shift your weight around a lot more and move around so much more as you work, whether it's moving your weight from one side or the other, putting your leg on a stool. It's just a great alternative to just sitting for a long, long time. Now, as I was saying before, whether you're sitting, whether you're standing, the principles of posture remain the same. You want to keep your head up. You want to keep your shoulder blades back. Everything should still be in that relatively neutral position. But by having the sit to stand desk, you just have a little bit more options to work with. But saying that, even if you have a standing desk, I want to bring up the idea that even prolonged standing has its negative effects. There's a study out of the Journal of Ergonomics of 2018, looking at the detailed description of the short-term effects, musculoskeletal effects, and cognitive effects of prolonged standing for office computer work. And the idea of why they were doing this study was because even prior to COVID, there has been a huge transition and a huge trend moving away from sitting at your desk all the time and going towards standing. And naturally, there has been such a big shift that we wanted to take a look at, well, what are the effects of that now? And this is what they found, and this is what they did. So they tested 20 adults, and after 2 hours of prolonged standing, they wanted to measure, 1, was there any discomfort in terms of their muscles and in their body? They wanted to look at their cognitive function, along with things like muscle fatigue, lower limb swelling, and mental state. And this is what they found, that after just 2 hours, there was naturally an increased discomfort in all areas of their body, with sustained attention and reaction time also deteriorating. The only thing that actually improved was the creative problem solving. Naturally, lower limb swelling also increased, as well as their mental state. It also decreased a little bit. Which brings me to my point again. They wanted to conclude that standing, although is being used to replace sitting by office workers all around the world, there are also health risks associated with this. In the study that they did, they found that naturally people reported discomfort in all areas of their body, decrease in the reaction time, decrease in their mental state, and the only improvement, as I was saying, was in the creative problem solving. And that they warned that if anyone was to engage in prolonged standing at work, that this should be undertaken with caution as well. Which brings back up to the idea that I've been trying to just kind of talk about today. You know, is it really all about posture? And what I want to tell you guys is, no, it's not. Regardless of whether we have the perfect posture, whether it's sitting, whether it's standing, whether you have the best chair, whether you have the best sit to stand desk, if our idea and if our goal is really to try to prevent the pain, prevent discomfort, prevent injury, the whole notion of what I'm trying to say today is that we need to move. Regardless of we have the best core, the best posture, the best chair, if we're not moving enough, with time, you will probably start having some of the symptoms that we already discussed previously. All right, so I think it would be a little injustice for me if I talked about all that and we didn't take a quick break and just stand up and do a couple of quick motions. So if you guys are sitting, let's just stand up. Let's just do 5 shoulder blade squeezes. This is where you're just gonna do a couple of shoulder retractions. Get that body moving, get your body going, loosen up some of these muscles. And hopefully you guys naturally feel a little bit better. That is part of what we're talking about today. So at least we get a little movement going on today. Okay, let's go on. So after talking about all that, the next most common thing that people like to ask us, and we encounter almost day in and day out, is the question and the idea of, what are the best corrective exercises to improve my posture? So this is where this is gonna get a little bit more interactive today. And Adam's already helped set up a poll for all of us. And I want, if you guys have access to your phones or your computers, to just throw out the answer that you guys think is correct. So the question, out of the following, which one do you believe is the best exercise to correct your posture? And if you guys aren't familiar with the names, I put some of the diagrams there. Is it the shoulder row and scapular retraction? That is the picture on the top left. Is it the infamous plank that I'm sure we all might have heard of or seen before? Is it the glute bridge, which is on the bottom right? Give a lot for strengthening people's glutes and strengthening core and lower back muscles. Is it that chin tuck that we hear so much about for that forward head posture? Or is it the new all-time favorite among physiotherapists, the dead bug exercise? If you guys think you have the answer, feel free to throw it up in the poll, and we'll see what everyone else thinks as well. There's a second question is coming up here. Of the following types.
Sorry, Tim. I'll just we'll just what we'll do is we'll allow this poll to go on for a little bit longer, and then we'll get into the second one afterwards. I think the best way to do it.
Okay, sounds good.
Can you see the results, or should I read them out?
You can read them out.
Okay, so I'm going to end the poll here. Okay, drum roll, please. So we have a tie. We have a tie for first. We have shoulder rows and scapular retractions, and dead bugs as the top rated choices, followed by planks, glute bridges, and then lastly chin tucks. Tim.
Nice, very trendy of you guys to choose the dead bugs. Good choice. All right, I'm going to reveal the answer later, but okay. Good choices. Let's move on to the second question. All right, so shoulder retraction and dead bugs were tied at 9 each. Question number 2. Out of the following types of exercises, which are the best for correcting your posture? Is it 1, Pilates? Is it 2, yoga? Is it 3, swimming? 4, strengthening? Or 5, stretching? All right, throw out your answers and let's see what we get.
Okay, good. We got lots of votes coming in. Thanks for the participation, guys. This is great.
Thank you.
We'll let it go just another few seconds, Tim.
Sounds good.
Mostly everybody here. Okay, so I'm gonna end the poll. One last vote came in. And okay. All right, so strengthening finished first. Okay, followed by stretching. And then yoga, Pilates, and swimming was the last.
All right. I'm interested to hear what you guys think about this stuff. But good choices again. I mean, don't get me wrong, these are all great, and I'm going to reveal the answer coming up. But thank you for the participation. Hopefully this allowed you guys to think a little bit more. I want this to be as interactive as possible. And as I was saying from the beginning, if you guys have any questions or anything that pop up, feel free to throw in the chat and we'll try to help answer that later on. But before I answer the question to the two that I just asked you, I'm going to bring up the next article that I thought was interesting. And this article came out of the Journal of Exercise Rehabilitation and is relatively new, came out last year in February 2020. And it's titled The Exercise Interventions to Improve Postural Malalignments in Your Head, Neck, and Trunk Among Adolescents, Adults, and Older People. And this was a systematic review looking at all the studies that have been done over the past several years. And this looked at over 22 randomized control studies, and there were over 1,200 participants as identified as having postural malalignments. So the postural malalignments were some of the things that we talked about before, whether it's like kyphosis in your thoracic spine, your lumbar lordosis, around your shoulders, forward head posture. These were all classified as potentially having some postural alignment. So if whether you had one or all of them, this was what they were looking at, and this was what the study was trying to determine. Couldn't they find one exercise that trumps the rest of them? Now, there were some parameters that they looked at, in that whatever exercise intervention that they did, it had to follow the total duration ranging from 2 to 13 weeks, having a frequency from 2 to 4 days per week, and the duration of each intervention lasting between a minimum of 15 to 60 minutes. Now, these interventions included a whole sort of different types of exercises. It ranged from group spine strengthening and posture training for people with hyperkyphosis, functional strengthening, things like squats, things like lunges, range of motion, stretching for people with hyperkyphosis, some of the exercises mentioned before, like planks, glute bridges, scapular stability exercises for forward head posture, deadlifts for lumbar lordosis, cervical retraction. Those are like the chin tucks that we're talking about, cervical mobilization exercises for forward head posture, Pilates, yoga, strengthening, stretching, swimming. So essentially, they tried to look for as many different types of things as they could and see if one was superior than the other. And guess what they found? One, they did conclude that majority of the randomized control studies in the past 23 years did indeed find positive effects of exercise for postural malalignment. Meaning, if you did some exercise, you probably had some change or some improvement in whatever posture malalignment that you were dealing with. However, the idea of a best exercise was inconclusive in what they said, and that based on these studies over these past several years, there is no one exercise that is by far better than the rest. What they did find that would yield the best results was, if you wanted to improve your postural malalignment, the key is not in terms of what exercise you did, but the frequency that you did something. And this is what they said. It must be done on a minimum or an average of 2 to 3 times a week, between 15 to 60 minutes, and it should consist of a combination of stretching or strengthening with a focus on what we call neural and muscular components. So for those who don't know, neuromuscular is the idea of understanding how to coordinate muscles and their coordination and activation with one another. Sometimes we talk about this in terms of proprioception, muscle activation, muscle recruitment, motor recruitment. The more we start training, the idea is you will start to have a better awareness and better connection with how your muscles are starting to fire. So I thought this article was very important because it outlines and it really debunks the idea that people always come to us asking us for that best exercise. We hear it a lot and we see it a lot even in social media of people claiming that one exercise is the best and that if you're not doing this exercise, you are doing yourself an injustice and you're not going to get the best bang for your buck, or you're not going to build up your core. And essentially this article really tells us that this is not true. That regardless of what exercise that you want to do, they can all yield awesome effects. At this current time, we don't necessarily know what's better, but the idea is if you move more, if you're consistent, that is what's going to help most with your posture. Going back to the idea of what I was bringing up before, right? It is not the idea of posture that I want to talk about. It's the idea of, are we moving enough throughout the day? So the summary that I want to say is, it is not so important what exercise you do, but how often you do it. There's a quote by one of the therapists that I really like, and he says, the best exercise is the exercise that is being done. So to answer the questions, I think you guys already have a little bit of a clue of what I'm about to say. Essentially, you guys were all correct in what you guys chose. Really, the answer is all of the above. There is no best exercise. The best exercise is the one that you really choose to do for that day, or the ones that you're going to choose to do. If you're thinking that one exercise is going to be enough to correct your position or correct your posture, unfortunately, that probably is not going to be it. If you just do dead bugs, is that going to help? Yes, but it probably won't give you as much benefit as you're really looking for. As we're saying, and as I want to emphasize, it's how much you do. Over a week, over a time period, are you putting in? Are you doing enough repetitions? Are you doing enough sets? That's really the whole idea of what we're trying to talk about. If you're a person that enjoys swimming, if you're someone that wants to do Pilates, if you want to just do more walking, those are all great options, and those are all things that we would recommend. The idea is we just want you guys to start moving more and think of more of the idea of motion and the idea of mobility. I want to bring up a couple more articles that I thought would emphasize this point just a little bit more. And this article comes from the Journal of Spine and just came out a couple months ago, actually, talking about the association between a new term we call text neck and neck pain in adults. So the idea is that there has been an increased prevalence of people coming to us or reporting neck pain. And there's a belief that this is due to things like the use of smartphones, the use of handheld devices, maybe working from home, and that has led to more neck pain. So the study wanted to investigate the association between text neck and neck pain in adults. And I was saying, based on what I was saying there, they think there is a link behind that. And this is what they found. So they took 582 volunteers between the ages of 18 to 65. They had a self-reported questionnaire on how much pain they had. And they had someone measure their neck angles while they were using a phone in a standing and sitting position. And guess what they found again? Text neck was actually not associated with the prevalence of neck pain. Meaning neck pain frequency, or the maximum neck pain intensity in adults, was not necessarily associated with how far you're bending your neck or holding that neck in that position. Going back to the idea of the posture, just because you may have a little bit more of a forward head posture than someone else, that does not mean you're naturally going to have more neck pain. There are ways to combat this, and I think this article just shows once again telling us that just because you have that, not always indicative of having pain. There's another study to further just prove this point. They looked at text neck and neck pain in 18 to 21-year-old adults. Same thing, looking at the association between text neck and neck pain. they had 150 students do a self-questionnaire. And this time they had physiotherapists assess people's neck posture. And once again, there's no association between text neck and neck pain. And it really challenges the belief that neck posture during mobile phone texting is associated with the growing prevalence of pain. And this goes to the whole idea that just because someone comes in with rounded shoulders, with potentially, say they've been realizing that they have poor posture and they've had it for years and they're very concerned, that really does not mean that you are naturally going to have pain. What we're trying to tell you and say is, rather than worrying so much about trying to continue to focus on the idea that you might not have the best posture, think about, are we moving enough again, right? If we're exercising, if we're moving, if we're changing our positions throughout the day, that is probably the best bet to start overcoming whatever posture or postural malalignment that either one of us may have. And I will say that probably most people, and 90% of the people that we see, most of us have some sort of postural malalignment. It is very rare that we see someone coming in with that perfect standing posture or that perfect sitting posture throughout the entire day. And I wanted to just bring up some of the recommendations by the ACSM, the American College of Sports Medicine, because I thought this was relevant and also very important. And this is talking about the exercise recommendations that have been released, and I'm sure a lot of you guys know. And which is, if you're an adult age 18 to 64, that you should be on average on a weekly basis aiming to do a total of 150 to 300 minutes of moderate intensity aerobic physical activity. Or if you're the type that wants to do high intensity, then at least a minimum of 75 to 150 minutes of this. This should also be combined with some muscle strengthening activities as well, at least 2 or more days a week. The combination of this aerobic and this muscle strengthening goes quite in line exactly with what that article was talking about, of the frequency of the number of exercises and movement that you should be doing. If we're following these guidelines that have been set out and that we've known for a long period of time, naturally, not only are we going to be improving our posture, but you're going to get all the other assortment of benefits that come with just doing more exercise. And once again, just more movement. This is a chart directly from the ACSM talking about the other benefits that we get if we start exercising, we start moving more. This is talking about the benefits of resistance training, more than just posture. Naturally, we have improvements in muscle strength, more improvements in endurance. You'll have increased durability and naturally decreased chance of injury to your bone, muscle, and connective tissue. We're talking about neuromuscular connection before. You have a better improvement in the connection between your brain and how they fire. You have improved blood glucose regulation, controlling of your sugars. And this is in combination with the aerobic fitness that I was talking about. So I thought, to summarize, with aerobic training, in addition to improving your posture again, naturally you'll have an improved quality of life. Not to mention just improve overall function of all the different organs in your body. Improve natural physical function. And if we're talking about and addressing things like mental health as well, as we are going through this COVID and this lockdown, anxiety and depression is also a huge thing. And if we're really just narrowing on focus on posture, we're not really looking at the bigger picture here. In that if we just start to move, we will just naturally start incorporating and getting the benefits of all these things. Same thing, as I was saying before, with the health benefits of resistance training, improvements in their muscle, improvements in connection between your brain, blood glucose regulation, bone tissue and muscle connectivity, and just decreasing the chance of an injury. Okay. Before I move on, do you guys have any questions, or do you want me to move straight into the last thing that we're talking about? I know we're already 40 minutes in. Are there any questions right now that that are there that people want to ask, or do you want to just keep moving on for a little bit?
Yeah, hi Tim. Yeah, some questions are coming in. I think let's move on first, then we'll address all the questions at the end.
Okay, okay. So I'm going to move on. I think because it's taking a little bit more time, I'm going to briefly go through this. I did want to address the idea of some injuries that I have been seeing since COVID. And I'm going to actually simplify this a little bit and not going into too much about the specifics of the injuries, but more into two categories that I've really been noticing. And one, this is the ones that we're already talking about. There's been two groups. The group that is either not doing enough exercise and not moving enough, and the other side, the ones that, you know, they want to have the good intention to want to exercise, they want to start moving more, but they are doing too much too quickly. So with the first group, we already talked a lot about this. The group that is not doing enough, whether they are doing prolonged desk work, they're standing too much, lack of exercise, lack of movement. I've been seeing a lot of people coming in with things like neck pain, back pain, tension headaches. Once again, this is not new, right? Now, with the increased working from home, this has increased a lot more. But even prior to the whole work from home situation, this is a common theme and a common trend that we see a lot here at the clinic. And the other one that we also see a lot, as I was saying before, are the ones that have been jumping into doing something a little too quickly or doing a little too much. And this is, I applaud people for the idea of wanting to exercise more. This is good. This is what we're trying to encourage. But with the whole switch, I know a lot of people's workout and gym routines have really been altered, and people have had to pivot from what they were used to doing. And a lot of people have been moving more to online workout programs, trying things like HIIT, trying different recommendations like yoga, going more for hikes, maybe potentially running a little bit more. And I've seen a lot of different injuries resulting from that, whether it is hip, knee, shoulder tendinopathies. A lot of people have been coming in with that. A lot of runners need, because that is one of the few things people have been able to do. Either doing more jumping jacks, plyometric type of exercise at home, or going up for more running or more hiking. We've had a lot of people coming in with these types of conditions, and a nerve root impingements as well. I had a patient near the beginning of COVID, and same thing. I think it's an awesome thing. He was trying to do more exercise, and he thought he wanted to participate in this push-up and this sit-up challenge. And he knew himself right when he came in. He knew that he hasn't been doing a lot of push-ups. He hasn't been doing a lot of sit-ups, and he tried to push through it and tried to make a personal best and all this stuff. And what started resulting was he actually ended up pinching a nerve in his neck, and because of that, he had to get some physio and get some treatment on this. And what I want to, and I'm going to skip actually the next couple of slides so we move into the questions. And what I really want to summarize today about injury prevention and for you guys is to tell you guys that regardless of what exercise you do, as I was saying, all exercises can be good. There needs to be an idea of preparation and a gradual progression. For those that are used to doing potential like low impact exercises like elliptical, biking, if all of a sudden you jump into something like running, naturally there are a little bit more risks to your body, to your joints, to your tendons, because there is a period of adaptation that always needs to persist. If you don't prepare your body, or if you don't gradually progress with your training, there is often an increased chance of increasing your injury risk. Another thing is the idea of consistency. There's a lot of research to continue to show that the idea of consistency, the more consistent you are, going back to the idea of frequency, the more you start setting yourself in a consistent program, this is by far one of the best ways of preventing injury. One of the classic mistakes we tend to see is people get that new, whether it's solutions or the sudden urge to want to do more exercise or suddenly move. They participate in a high impact or an exercise class, and they just do a little bit too much too quickly. And they end up hurting themselves, and they actually have to stop doing exercises again. And this is one thing we always try to emphasize. It's not how much you do right now, it's how often or how over a long period of time you're going to be doing exercises. I was going to talk about this idea called an acute chronic workload ratio, but I think we're going to skip it for today. There is some information on the slide, so if you guys want to go back and take a listen to it, there is some research for those that like the numbers. There is what they find an acute chronic workload ratio, that if you work within this ratio, potentially this is another way that we can help calculate and reduce the risk. But all the principles that I was saying before, that in itself, if you follow these things, that is one of the first steps you can do to really prevent injury. So just to summarize everything that I was talking about today. As I was saying, not just myself, but there's a lot of physios, and in the physio trend, this is what we're trying to start telling you guys. Let's start moving away from focusing on your posture and start focusing on movement and mobility. I know I said that a lot of times today, but hopefully that point is really coming through. Good posture is great, but movement is even better. There is no one best exercise to do. The best exercise is the one that is getting done. As I was saying, consistency and frequency is by far the most important factor of improvement if you're looking for change in your terms of your postural malalignments or change in your symptoms. And last but not least, when starting a new fitness regimen, slow and steady is always the key to injury prevention. All right, I think that's it. So if there are any questions, feel free to start sending them in.
Okay, thanks, Tim. That was excellent. I know I changed my posture about 20 times during your presentation, and I'm sure everybody else did at home. So now I'd like to open up the floor for some questions. Some have already come in, and I will start with those. But if anything else is piquing your interest, or you want to ask Tim anything, feel free to ask those in the chat or question and answer section as we go. Okay, Tim. So first question is coming from Anne. Are there any specific features of a good standing or good sit to stand desk? Should there be a desk tray underneath the table?
Yes and no. Once again, I think the sit to stand desk should allow for options of being able to move around your arms and move around your shoulders and move around your hands and wrists. If the desk is really restricting you, that you have to reach forward, reach for that keyboard, reach for your mouse, then you're not really giving yourself that that potential to maintain that ideal posture that we were talking about. Now, saying that, if you don't have to, like a lot of people right now don't even have an option of having a sit to stand desk. And what I was trying to say is, even if you don't, that is okay. If you're moving around and changing your position enough, if you don't have a standing desk, that is okay. You can be completely fine with working at a sitting desk. You may just have to get up and move around a little bit more than someone with that standing desk. If by chance that you have the option of having, what was the question? Like something underneath that desk you can put your keyboard with?
Yeah, it was a desk tray.
Yeah, I think that would be awesome because naturally you can move that desk tray closer towards you. You don't have to stretch as far out. And I think that naturally will lend to a better posture if you are standing for a longer period of time.
Okay, that's great. Okay, so next question is coming in from email from Claire. She says, great job today, Tim. And she is wondering if you have any strategies or recommendations for breaking up sedentary postures during the workday. Like, I think she's looking for like any, any things you might recommend your patients in terms of ways that they can stay on top of that and be aware of it during their workday.
Yeah, honestly, great question. And we get that asked actually quite a bit. I'm sure Adam gets that asked all the time in your practice as well. One of the first things we always tell people is maybe set yourself like a break or a timer. Give yourself a little bit of a alarm to kind of tell yourself that, okay, now it's time to move. I know a lot of us, when we get focused into working, it's very hard to think about our posture, think about, okay, I need to be moving or I need to be doing a certain exercise. So setting that timer, I find, has been very effective for a lot of my patients, whether it's 15 minutes, whether it's 30 minutes. Um, I think either way, if you start off with one of those, that is a good option. Why I actually brought up in the previous, the trivia questions, those exercises, those are good exercises that anyone can actually do, regardless if you have any equipment. Shoulder retractions is one I probably teach every single day to at least one patient, because we don't need any equipment to do that. And that's something you can do just sitting at your desk all day. So doing 5 retractions every hour can really help with just decreasing some of that tension in your upper traps and in the shoulder blade area. And doing things like the chin tucks I was talking about, great for people that are naturally have to look down a little bit more or have that natural forward head posture. These are 2 little things that you can start doing a lot. If you have a gym mat or you have a little bit more space in your office or at home, you can get down, do a couple planks, do a couple glute bridges. That is a good way to start incorporating the lower body as well. Like I said, the more muscles you start recruiting, that is probably where you're going to start getting a little more benefit. But the whole idea really starts from giving yourself and setting yourself up with some reminders. And I think whether it's putting on your phone, putting on your computer, little sticky notes, these are things that I have recommended to patients that I think they have found effective.
Okay, great answer, Tim. Next question coming from Warren. He's wondering, what exercises would you recommend for someone in their 70s specifically?
Um, Good question. Now, if someone in their 70s, it's a little more complicated, because I do also would want to assess if there's other injuries or other health issues that I need to be aware of. First and foremost, I probably would recommend someone to start walking. Walking is by far one of the most well-researched and most recommended exercises and safest exercises that you can start doing. There are plenty of benefits with walking, in addition to loosening up your muscles. For people that have low back pain, this is one of the first things we always tell people to do. We understand that naturally as people age, people may have more high likelihood of different joint pain. So things like impact exercises might be a little bit harder. So walking is something I would recommend. Getting into some simple or light yoga, some simple stretches, these can go a long way. It doesn't actually have to be anything too complicated as what we've been finding. Start off with something small. I would definitely recommend more of a low impact, whether it's cycling, whether it's walking. These are probably the 2 best options to get your aerobic fitness in. And then a little bit of resistance training, whether it's using bands or light weights. Try to do a little bit that incorporates all the different muscles in the body. A shoulder press, some rows, some bicep curls. If you engage a little bit of everything, you will probably get the best bang for your buck, and you'll start feeling the benefits of that.
Okay, great. Next question coming in from Annie. Is SI joint tension or pain caused by extended time in sitting?
Yes, that can be one of the reasons, but lack of movement can be another reason. SI is often, when we look at SI, we look at what we call slings in the body. And when we're looking at slings, we're looking at the coordination and the neuromuscular control that we're talking about. If you have poor neuromuscular control, if you're not recruiting enough of your muscles, if you're not engaging your core enough, these are all potential reasons of having SI pain, not just specifically from your posture or from tightness. There are assortment of reasons that people may have SI pain. So that is one of the reasons, but not the only reason.
Okay. Next question in coming from Kelly, and she says, "Thank you, Tim." And we say, "Thank you, Kelly, for joining us today." She's wondering, how long should you sit before you get up for a break? That's a great question.
Awesome question. Now, that will depend on whether or not you have any other injuries that you are dealing with. So going back to the idea of the standing desk or standing, a lot of times when people sit for a long time, the 2 most common complaints is the lower back pain and the upper neck tension. If you've had any type of lower back injury, we do know that sitting generally is not as great for that. So if you're dealing with a lower back injury, and especially if it's in an acute state, then you probably will have to start off with a shorter period of sitting. If you don't have an injury, your sitting tolerance probably can be a bit longer. But I would recommend to start off at probably about 30 minutes and get up. And usually what I tell a lot of my patients is when you get up and move around, it doesn't have to be that long. Getting up for what we were doing before, even if it's 10 seconds, move around, do a couple high knees, just do a couple hip rotations or rotations in the body in your thorax. That is enough to kind of break up that motion that you were just in, and you can get back to sitting. I find if you are dealing with an injury, you'll have to start off a little bit shorter. So maybe 15 minutes to start off with. But if you don't, and you've been exercising a lot and you aren't dealing with anything, then 30 minutes I typically would recommend is a good time. And sometimes people can start stretching that out a little bit more. But 30 minutes, I would say, is the ideal time that I tend to recommend the most.
Awesome. Okay. Next question coming from Cameron. Any treatment for runner knee pain, Tim?
Yes. Um, and specifically treatment in terms of exercises or recommendations that we give. Runner's knee is, we term it patellofemoral syndrome. So when anything is termed a syndrome, it means there's an assortment of different reasons for this pain. This can be weakness in your glutes, could be the fact that your feet are more pronated than others. Runner's knee can also be from a training regimen where you're doing too much running too soon, or too much of a high impact exercise too soon. There isn't a simple answer to that question because there are a lot of reasons for that. So when someone comes in with runner's knee, part of our job as a therapist is really to assess what are these reasons that are causing that. And lots of times it's actually an assortment of these things, whether it's a muscular imbalances, whether it's poor running technique, whether it is the fact that you may need orthotics, whether you have weak glutes. These are often common areas that we will look at in terms of runner's knee. So yeah, I don't have a simple answer for that, because there really can be a whole assortment of reasons that someone will present with that condition.
Okay. That is, oh, I think maybe one more question coming in, Tim, and then I think we'll end it there.
Okay.
Again, from Annie, any treatment or exercise recommendation for piriformis pain in the buttock area?
For piriformis pain, yeah, one of the most common stretches we would give for piriformis pain is probably, well, based on the name, the piriformis stretch or the figure four stretch. I don't have a diagram of that picture right now, but it is when you're having one leg crossed over the other and you're bringing the opposite knee towards your chest. This is a great way to get a stretch in that part of that muscle. Another thing we often recommend for piriformis syndrome is using like a massage ball to try to massage it out. Lots of times people may get piriformis syndrome because they're sitting for a long period of time, and that pressure over that muscle has caused it to increase its tension, increase its tightness, leading to some of the symptoms that we tend to see with piriformis syndrome. So trying the piriformis stretch and using massage ball to try to release that muscle are probably the two things I would recommend for that.
Okay, perfect. I think we'll end it there. Thank you very much, Tim. It is 12 now, and I'm sure everybody wants to get back to their Saturday. Last time I checked, sun was shining out there, so try and get out, change up your posture a little bit, get some exercise in, do some of that stuff. Just like to thank you guys for joining us today, and thank you for anybody that joined us through our other previous webinars as well. We will try and get this up on our website as soon as possible. I hope to have the video of this presentation up by next week. So if you'd like to go back and look at anything or read over anything again, check it out there on our website at Semi Shepherd. Okay, guys, take care. Have a good Saturday. Bye now.
Bye, everyone.